Hi, good morning, everybody. It's Dr. Lisa. Thank you guys for joining me. I hope that you had a weekend filled with some moments of peace and some of preparation as we continue on this course of uncharted waters. First, I just wanted to update you on some of the research that I listened to and studied over the weekend. As we know, the number of cases is going up, of COVID-19 is going up exponentially. I want to say that, in my opinion, this is because the testing is increasing, which is a good thing, so that if people test positive, they can self-isolate in a more restricted way than what everybody has been doing. The fear-based panic that's going on with the numbers, I think if we really were to look back, that the potential that this has been going on in the US for longer than we think is probably the case. Understanding that most of us are going to get exposed to someone with COVID-19 and trying to prepare our bodies so that we can have minimal or no symptoms is imperative, and where I want to focus my attention with you guys today. There are many things that you can do to prep your body for potential infection. I agree with the social distancing being the main way to flatten the curve, and we've all heard that on the news till we want to just turn it off. And I want to say thank you. I think despite all of the negativity and criticism that's going on, people are really stepping up. You know, the streets are empty, people are staying home, people are reconnecting with their families, people are washing their hands. Just keep doing that because it's going to help. I know it is, even if, we're not going to see it immediately. So continue washing hands. And a couple of the tips I heard over the weekend that were helpful. One is that if you do get the virus or get exposed, the problems that come up, as we have heard, are respiratory. And the biggest issue is that the respiratory secretions are very thick and they can clog your bronchioles, which are your airways in your lungs. So one way to help that is actually with hot liquids. So in addition to drinking, so remember one of the earlier recommendations is that you continue to drink something about every 20 to 30 minutes. We're now saying to have it not maybe be room temperature, the regular water, and I like water with lemon if you can get it, because it will also help your pH. But make sure you drink throughout the day, because the respiratory particles, even if you do inhale them, they can get stuck in your throat, and you can prevent them from going down into the lungs and creating these thicker secretions if you're drinking. Once the virus goes down into your stomach, it is killed off. So it can't survive in the stomach, which is nice. The stomach acid will take care of it for you. So drinking about every 20 to 30 minutes, which I want my patients staying hydrated either way, but also consider making sure that it is intermittently exchanged with hot liquids. So something like hot tea, which is my favorite, peppermint tea, or just even hot water with a splash of lemon in it. That will keep the mucus secretions more liquefied, so they're less likely to get stuck in your respiratory tract. Again, also continual hand washing. I don't know about you guys, my hands are killing me. I've never washed them this much in my life. I feel like I'm back in residency and I'm scrubbing in on a case, so I'm kind of able to embrace those memories. So now to discuss some of your best tools for prevention. And what I wanted to mention today is something called the parasympathetic and sympathetic nervous system. So many of you have heard of fight or flight, which is a response that we get into when we are stressed. It was originally for when a beast was chasing us, back when our ancestors would be having to survive daily, and they would flip into this fight or flight response, and then they would escape the beast and they would calm down. In our day and age, not to mention during this whole corona epidemic, we tend to stick in that fight or flight response and we don't ever calm down. So when we are dealing with that fight or flight response constantly, which is, again, prior to this, a high percentage of my patients, the immune system is not able to work at the highest possible level. So you are living in fight or flight, constantly feeling fast-paced, like you can't get your hands on things, you can never catch up. Things are out of your control. Your heart rate may be a little bit higher. If you check your blood pressure, sometimes it's a little bit on the edge. We are now finding that those types of symptoms, higher blood pressure, a little bit faster heart rate, impede the function of the immune system, and outcomes from COVID-19 can be a little bit or a lot worse. So what I want you to do is just take a moment, and I can tell you, as someone who meditates daily and is very centered as a general rule, I have now, just like most of you, I'm sure, felt myself tap into that fight or flight panic emotion as we are prepping for the uncertainty of what is to come. I've also been able to feel myself take back control and calm myself back down into parasympathetic. So the nerve that controls these two sides of the immune system, of your nervous system, is the vagus nerve. We're going to talk more about that in the future. But what I want you to do now is just take note. We all have a little more time right now. So take note within your body of when you're feeling that panicky, like fight or flight, versus able to get back centered and calm. And as we talked about on Friday, what does that for me is meditation, but I'm going to give you a quick tool today, which is just box breathing. I don't know how many of you have heard of that before, but box breathing is simple. So just if you're starting to feel in that panic mode, take a second, ideally get outside if you can, because we know that nature almost immediately calms us, but I want you to breathe in for 4. So take a deep breath. Go ahead and do that with me now. Then hold your breath for 4. Then breathe out for 4. And then hold it again for 4. So that's where it got the name box breathing. So just breathe in for 4, hold for 4, breathe out for 4, hold for 4. That will trigger the side of the vagus nerve that puts you back into parasympathetic. So it's like the gas and the brake. It'll get you off the gas pedal, which unfortunately, again, we have all been on right now, and back into a balanced brake. When you're in that space, your immune system, which is what we need right now, more than ever, can step up and do what it needs to do. So I want to end with my affirmation for today. This affirmation is, I embrace uncertainty and fear with curiosity and love. So I want you to take these uncertain times and just kind of go in and say, be curious. What is this triggering in me? How am I responding? How can I shift my perception? And always working on replacing fear with love. So I embrace uncertainty and fear and replace it with curiosity and love. Thank you guys for joining me. I will be here tomorrow as we continue this together. Take care and stay safe and healthy. Wash your hands. Wash your hands.